Okay, this is my SBAR for Nigel Nephron. Nigel Nephron is a 66-year-old male, date of birth 5/13/19XX. He is a full code. He has seasonal allergies. The patient presented to the emergency room with complaints of fatigue, weakness, shortness of air, muscle cramps for the past couple days. The patient has a history of hypertension, hyperlipidemia, peripheral neuropathy, chronic renal failure, and he has a stent in his right forearm. The current vital signs for the patient are blood pressure 162/97, pulse 110, respirations 24, temperature 98.5, and SpO2 92% on room air. The orders for this patient are ACHS blood sugars, vital signs every 2 hours. He's on a renal diabetic diet. He's on a 1,000 milliliter fluid restriction every 24 hours. He has a strict INO, and we initiated an IV with this patient. So we have given the patient his medication. We gave him his lisinopril, his furosemide, his calcium carbonate, his insulin. We gave him 4 units. His insulin was 250 when we took it. We hold the metoprolol because his diastolic blood pressure was low. After we gave him those medications, we called the primary care physician. We told him what his vital signs were. The primary care physician told us to go ahead and give his metoprolol because it wasn't too low, so we gave him the metoprolol. So he also ordered 1 amp of D50 IV push over 1 minute now. We were to give 10 units of insulin now. We also ordered calcium gluconate 10%, push over 5 minutes. That was also now. He is placed on a cardiac monitor. He was also ordered sodium polystrate sulfate rectal now. And then we were going to check his potassium in another 30 minutes. So after all those ordered medications were given and he was put on the cardiac monitor, we checked his potassium, and the lab is waiting for us to get back. We are waiting on the lab values to get back. When we called the physician, some abnormal lab values were sodium 133, potassium 6.1. His GFR was at 20. Bun and creatinine both elevated, 68 and 4.3. Phosphorus, magnesium elevated, 4.9 and 3.2. Calcium was low at 7. Glucose was high at 250 when we checked it. His pH was low at 7.32. PaCO2 low at 33. HCO3 low at 19. So he was presenting in metabolic acidosis. My recommendations for this patient are to keep him on a cardiac monitor his potassium levels, monitor his intake and output, monitor his electrolyte imbalances and balances, monitor his GFR. And I think that is it.